Coming up on Great Day, it's Medical Monday, and you have the chance to go one-on-one with our medical experts. We're taking your health questions. Just send us an email to greatdayhouston@khou.com. With that being said, here is our medical panel for today.
My name is Dr. Pasha, and I'm going to show you how we can alleviate your sinus and allergy problems in the office.
I'm Dr. McClendon. If you want to get Beachbody ready, stay tuned.
Hi, I'm Dr. Terry Alani. I'm going to tell you what's lurking on your toothbrush today and also what to look for when buying a toothbrush, so stay tuned.
Hi, I'm Dr. Tess Grover, and I'm here to give you some health tips to help you keep your summer safe.
Hi, I'm Pharmacist Gina Eubank. I'm here to answer all your over-the-counter and prescription questions.
It's Great Day Houston, and now here's your host, Deborah Duncan.
Welcome to Great Day, everybody. The doctors are at their computers ready to answer your questions throughout the show. Again, the email address is greatdayhouston@khou.com. All right, our first segment is something that many of you are dealing with right this very minute, me included, allergies and the symptoms they bring. Puffy eyes, runny nose, headaches. For some people, the best option is allergy therapy and even surgery. We'll talk about those options later. But for many others, the answer for temporary relief can be found over the counter. So joining us to talk about the right choices for your specific symptoms, please welcome Gina Eubank with HEB Pharmacy. Hello, Gina. All right, we see the ads and the whole bit, and sometimes we have a tendency to buy the thing that we saw on an ad, and it might not be specifically for us, but when we're faced with, and this is just a small fraction of everything to do with allergies, we sometimes get lost, and that's where you want to come in and say, ask your pharmacist. You're there for us to ask you questions, even about over-the-counter medications.
Exactly, because so many people, they walk down the aisle and they see all these multi-symptoms, and it's marketing, and it's overwhelming.
Yeah.
And really, all you need, there's 5 classes of drugs, and if a patient would get one of each one of those classes and speak to the pharmacist about which one is right for you, you can call us on the phone if you don't want to venture out of your house, and we can tell you, okay, that way you have inventory. And you don't need all this extra, because these are all multi-symptoms. And so many people, they'll think, you know, I'm taking one of these, it's over the counter.
Right, right. Now let's go through those five classes that you say we need to have. One of them would be like what? Antihistamine?
Antihistamine. And antihistamine is when you have a runny nose, like Exhibit A right here, and you're sneezing. And when you wake up in the morning and your throat is sore because you're lying down and it's draining down the back of your throat. So you want to, basically an antihistamine, it's like putting a little cover over those cells so they don't see what you're allergic to and it doesn't spill out all that mucus.
Okay, next category?
Decongestants. And that's when you get the pressure in here or up in here, and or if your ears, if you can't hear. And that will open it up. Now, with decongestants, you have to really be careful, because if you're on high blood pressure medications or heart medications or for depression, there's a ton. Speak to your pharmacist, because there's different options.
Yeah, and it says that on the back of a lot of those boxes, but I have a feeling that a lot of us, we just want our symptoms to go away. We don't take time to read that. So again, talk to your pharmacist.
Well, and a lot of people think, well, it doesn't apply to me because I'm on blood pressure medicine and my blood pressure is fine, so I can take whatever I want. And that's not it. So please ask us and we'll help you navigate that part.
Okay, and a histamine, a decongestant.
Expectorant.
Yeah.
This is when you've got that gurgly in your chest and you sound kind of wet when you cough. And the mechanism of action, the way that works, is the water that you consume, it actually gets with the mucus and thins it so that when you cough, it'll move. And it's
so when you take the expectorant, you need to drink a lot of water with it.
Tons of water, and that's not Coke, milk, things like that. Water. Just plain old water.
Milk and like orange juice, things like that can actually make your mucus worse.
Especially milk. Milk stimulates mucus production, and so we'll have little ones, and I'll tell the mom, you know, please just try to put them on the no dairy wagon if at all possible, just for even 24 hours, just so the poor child doesn't have as much mucus.
Yeah, and that expectorant can be important because that's where infections set in when the mucus gets too thick, and then it just becomes big problems. But if you can get that stuff out of there and clear it out, it helps.
Exactly, because it's a breeding ground. That mucus is really thick, and if you've got it sitting there in your ears or your sinuses, then the infection, that the bacteria get in there and make more, and you've got a whole family living in there.
I like how she goes, the bacteria gets
in there. Try.
Duke it out, right? Okay, so after expectorant, I think we're at what, number 5 or number 4?
for cough suppressant. This is for like a dry cough, okay? And you can, with all of these, if you have these 5 at home, then you can combine them together, and we can tell you which ones to combine.
Yeah, yeah. And with cough suppressants, I guess kind of like take that, it's kind of a double-edged sword because your body coughs for a reason. It knows what it's doing, but when do we cut it off, or when do we take the cough suppressant?
Well, a cough suppressant is when you can't sleep at night, and because then a tired body isn't going to be a healthy body. Then your natural immune system can't get in there and fight it. The other thing is, if it's a dry cough and you're not trying to be productive and get the mucus moving, you want to suppress that because it'll physically hurt. A lot of people say, I just hurt from coughing.
Right.
My diaphragm, my lungs, things like that.
Yeah.
So, and we can help you to decide when it's best to take a cough suppressant.
Okay, and then the 5th one?
Pain reliever.
Oh, yeah.
Okay? And which pain reliever, it also reduces fevers. We're talking about the Advil, the Tylenol, you know, that category there.
Okay. There are several sins that we commit when we're doing this, and one of them we were about to touch on. One obviously is taking the wrong medicine, so we went through that. But the other is taking too much, because how many of you have done this? If you take one and your symptoms haven't gone away, you just take another. Right? Even though the box clearly says 1's good enough, or 2, then you take 4. Right? We think more of a good thing is not always more of a good thing.
Exactly. I have so many patients that they're like, well, it's over the counter. It's got to be safe.
Yeah.
You know, the FDA, they've tested it, and they know, like with Advil, everybody takes 3 or 4 of those. So, and you can end up in the emergency room. And especially with, you know, the Tylenols, the Advils, this one right here, Delsum, the cough suppressant, people do not realize, you know, they'll think, oh, I'll just chug this. And you can end up hallucinating, you know, heart racing. I mean, it's really, really bad.
Yeah, and then, of course, the other thing that's really bad is when you start combining a lot of things. That one didn't work, so I'm not going to take more of that one. I'm going to take more of a next one.
And then it just compounds. It's layers on an onion, and before you know it, I mean, your heart's racing, you're sweating, and you're calling, and I'm going, let me give you the poison line. We have a crisis here. Or 911, even worse. So not an option.
So we talked about a lot of the oral medications, but we're seeing more and more ads about like the eye drops too. If your eyes are really kind of the only problem or the overwhelming problem with watering and stuff like that, there are eye drops, prescription and non-prescription, that you can use.
Exactly. And with a lot of people, they end up having to take an oral antihistamine as well as use the over-the-counter eye drops. And it works similar to the oral antihistamine, that your eyes don't see what they're allergic to, and then it stops the running and the itching and all of that good stuff. But if that doesn't work, you know, if this is where you're living, folks, you need to go ahead and see a doctor. Because
because the other point is, this is not the way you should do every day. These medications are basically for temporary use of maybe seasonal allergies.
Seasonal, exactly. This is a seasonal issue. If you're there every day and this is your life, or you're constantly switching products and wondering, I mean, it's time to go to the doctor and get to the root cause of it.
All right. For more information, log on to heb.com/pharmacy. And again, as Gina said, go ask. They're there to answer your questions, whether it's over the counter or prescription. Thank you.
Thank you.
All right, when we come back, you've taken the over-the-counter medications and they aren't working for you. So yes, it might be time to consult with a specialist to find out what you're actually allergic to. Then find the treatment or procedure that could help you deal with your allergies. Everything from allergy therapy, immunotherapy, to surgery.